What I'm about to share with you could save you days of misery and help you recover from one of the most brutal stomach bugs known to mankind. If you've ever experienced the sudden onset of violent nausea that hits you like a freight train, followed by relentless vomiting and diarrhea that leaves you completely drained, then you know exactly what norovirus feels like. But here's what most people don't realize about this incredibly contagious virus that affects millions every year. Welcome back to Health Treatment Center, where we break down complex health conditions into actionable recovery strategies. I'm here to give you the real truth about norovirus, what it actually does to your body, and most importantly, the fastest evidence-based methods to get back on your feet. Don't forget to subscribe and hit that notification bell, because the information I'm sharing today could make the difference between a week of suffering and a much faster recovery. Let me paint you a picture of what norovirus really feels like, because understanding your enemy is the first step to defeating it. It typically starts innocently enough. You might feel slightly off, maybe a little tired or have a mild headache. But then, usually within 12 to 48 hours of exposure, it hits you like a tsunami. The first wave is often the nausea, and it's not your typical queasy stomach. This is an overwhelming, all-consuming nausea that makes you break out in a cold sweat and sends you running to the bathroom. Here's what's actually happening inside your body during a norovirus infection that most people never understand. The virus specifically targets the cells lining your small intestine, causing inflammation and disrupting your body's ability to absorb water and nutrients properly. This is why you experience such severe diarrhea and why staying hydrated becomes absolutely critical. The vomiting isn't just your body trying to get rid of bad food. It's actually a direct result of the virus affecting your digestive system's normal functioning. You're watching this and thinking about someone you know who's currently suffering from norovirus. Drop a heart in the comments right now, because they need all the support they can get. The truth is, norovirus is often called the winter vomiting bug, but it can strike at any time of year, and it's incredibly contagious. Just 10 viral particles can cause infection, and an infected person can shed billions of these particles. That's why it spreads so rapidly through families, schools, cruise ships, and nursing homes. Now, let me tell you about the recovery strategies that actually work, because this is where most people make critical mistakes that prolong their suffering. The number one priority during the acute phase is preventing dehydration, but here's the key that most people miss. You cannot drink large amounts of fluids at once when you're actively vomiting. Instead, you need to take tiny, frequent sips every few minutes. I'm talking about a teaspoon of liquid every few minutes, rather than trying to gulp down a full glass of water. The best fluids for norovirus recovery aren't just plain water. Your body is losing electrolytes rapidly, so you need replacement solutions that contain sodium, potassium, and glucose. Oral rehydration solutions are ideal, but if you don't have access to these, you can make your own by mixing 1 teaspoon of salt and 2 tablespoons of sugar in 1 liter of clean water. Clear broths, especially bone broth if you have it, can also provide essential electrolytes and are usually easier to keep down than plain water. Here's something crucial that could prevent you from ending up in the emergency room. Watch for signs of severe dehydration, which include dizziness when standing, decreased urination, dry mouth and lips, and feeling confused or extremely fatigued. If you're experiencing these symptoms, especially if you haven't been able to keep fluids down for more than 24 hours, you need medical attention immediately. Severe dehydration from norovirus can be life-threatening, particularly for young children, elderly adults, and people with compromised immune systems. Let me share with you the dietary approach that can dramatically speed up your recovery once the acute vomiting phase passes. This is where the BRAT diet comes in, but with some important modifications that most people don't know about. BRAT stands for bananas, rice, applesauce, and toast. But the key is introducing these foods gradually and in specific ways. Start with tiny amounts, literally a few spoonfuls every hour, and pay attention to how your body responds. Bananas are particularly beneficial because they're rich in potassium, which you've been losing through diarrhea and vomiting. The pectin in bananas can also help firm up loose stools. Rice, especially white rice, provides easily digestible carbohydrates that give your body energy without putting too much stress on your digestive system. But here's the insider tip. Save the rice water, which is the starchy water left over from cooking rice. This liquid is incredibly soothing for an irritated digestive tract and provides additional electrolytes. Now let's talk about what you absolutely must avoid during recovery, because these mistakes can set you back days. Stay away from dairy products, fatty foods, caffeine, alcohol, and high-fiber foods until you're completely recovered. These can all irritate your already sensitive digestive system and potentially trigger another round of symptoms. Even after you start feeling better, introduce these foods slowly over several days. Comment below if you've ever made the mistake of eating too much too soon during recovery from a stomach bug, because I know many of you have been there. Your body tricks you into thinking you're better than you actually are, and then you pay the price with another wave of symptoms. Here are the natural remedies that have solid scientific backing for norovirus recovery. Ginger is one of the most effective natural anti-nausea remedies available. You can use fresh ginger tea, ginger capsules, or even crystallized ginger. The active compounds in ginger, particularly gingerol, have been shown to reduce nausea and vomiting in multiple studies. Peppermint tea can also be soothing, but use it cautiously if you're still actively vomiting. Some people find mint can trigger more nausea. Probiotics deserve special mention here because norovirus can disrupt your gut microbiome for weeks after the acute infection passes. However, timing is crucial. Don't start probiotics during the active infection, as your digestive system is too irritated. Wait until you're keeping food down consistently for at least 24 hours, and introduce a high-quality probiotic to help restore your beneficial gut bacteria. Let me address the elephant in the room that everyone wants to know about, but is often too embarrassed to ask. How long does norovirus actually last, and when can you return to normal activities? The acute symptoms typically last 24 to 72 hours. But here's what's important to understand. You can remain contagious for up to 2 weeks after your symptoms resolve, with the highest contagiousness occurring during the first 3 days of illness and the first 2 days after recovery.